We're also recording the webinar, just so you know, Amanda.
Oh, okay.
It's so you can access it afterwards.
Oh, perfect. I was going to make notes too, but that's good to know. It will just be in that portal?
I believe so.
Okay.
I think you probably would just access it off of the site, yeah.
Okay.
Everything's on there. Yeah, we'll get started. We'll just wait for the other two. They should be here in a couple minutes, hopefully.
Sure.
And are you seeing in the chat there, there's some messages as well? Are those coming up okay for you?
Yes. The last one I saw is 611, and it's talking about the microphones.
Oh, okay, great.
Is that the most recent one?
I'm just seeing now. They will get an email with the recording. So you guys will get an email with this recording. So we have JP's going to be helping us out with any IT issues. So he's just sort of silently in the background, and he's there if we need him. So if an IT type question comes up, he'll probably post on here.
Okay.
Okay. Oh yeah, you're right. That was the last one you could see at 6:11.
Yeah, I don't see one that says about the recording.
Yeah. I think that was just for me.
Oh, okay.
It's so strange doing like a webinar format because you're used to being with people in person, right? So it's like, all right, well, we're on. So wonder if I should, oh, here we have one more person joining in. Madeline?
Can you hear me?
Hi, Madeline, can you hear me?
Yeah, can you hear me?
Yeah, excellent.
Okay, awesome.
Are you Madeline?
Yes.
From U of T, Katrina's lab. You know me because you can see me.
Yep.
Yeah, okay. I thought that might have been you.
Yep.
Welcome.
Thank you.
We also have Amanda in the room, and she knows you from the training.
Yeah, hi, Amanda.
Hi, Madeline. How are you?
Good, how are you?
Good.
And we're just waiting for one more person. Her name is Cheryl, so she should be hopefully any second now. Maybe if you guys are okay with it, I'll give her a couple more minutes just to get in.
For sure.
Before I get started, because there's only 3 of us as well, so we should be we have plenty of time to talk and have a discussion. And then Madeline, when we get going, can you turn off your microphone when you're not speaking?
Yes, for sure. Should I turn it off now?
Leave it on right now because we're just kind of making small talk while we're waiting, so it's okay. But when I officially get started, when Cheryl joins, we can just turn off the microphone. Whoever's not speaking, turn off their microphone. It just gives a lot of feedback, and it's kind of noisy in the room too. So
for sure. Okay, sounds good.
Yeah, awesome. Okay, guys, I'm going to get started just so we can get rolling. And then when Cheryl pops in, we'll just sort of catch her up and say hello.
Sure.
I'm not sure when. And she can just join in, and it's recorded. So I think we're all right to get going.
Okay.
Okay, so if you guys want to just turn off your mics then for now. And then at the bottom of the chat, you'll see a hand. So if you raise your hand, You can turn your mic back on and then talk to me. And if you want, you can put your camera on as well. So that's your preference. So I'll get started. So as you guys both know, I'm Sarah Webb, and I live here in Toronto, and I work at the Toronto Children's Aid Society. I'm an intake worker on the domestic violence team at the CAS. I also work part-time for Katrina Scott in her lab on the Safe and Understood Research Project, and as well as I facilitate the Caring Dads program at Toronto CAS, and I'm a Caring Dads trainer now. So welcome to our webinar. And tonight's clinical consultation is on goal number 1 of the Caring Dads program. And I have a PowerPoint presentation. So what I'm going to do is put the PowerPoint on the screen, and I'll talk through the presentation. If you have questions while I'm talking, raise your hand and we can stop and we'll talk about it as we go. And then when I'm done the presentation, there'll be plenty of time to have a discussion and to chat about the material. So I'm going to get started. Okay, let me see, show slideshow. So can you guys let me know if you can see the slideshow okay? Can you see my PowerPoint? If you can just say in the chat room if you can see it.
Oh, I can't see it. I'm still seeing the main picture that was showing from before.
Oh, okay. That's my, okay, so I'm going to move slides. So now can you see this one?
Oh, yes.
Okay, perfect. It looks funny on my screen. Okay, got it. Okay, so back to the presentation. Let me just see, I'm just checking. Okay, got it, excellent. So what we'll be doing today, here's our agenda and a little bit of housekeeping. So we're going to have the overview of goal 1. So that will include the background of Caring Dads, which I'm sure both of you are quite familiar with. I'll talk a little bit about the use of the manual, the referral and intake process, and a review of sessions 1 to 3, which is part of goal 1. And as we've been talking about already, just raise your hand, and then I can answer your questions when you're ready, when you have one. And as I said, we'll have time after for discussion. And at the very end, when I log off, I'll send you a little quiz, and it's quite easy. It's just 6 questions. So that's our agenda. So what is Caring Dads? As you both know, it's a father's group, 17 weeks, 2-hour group, which includes individual sessions. Groups consist of around 15 fathers or less. I think some groups are quite a bit smaller, but I think we've sometimes done as high as 17, which is too many. So I think 15 is a pretty good number. And we include an individual intake at the beginning of the group, midpoint meeting, and final meetings. And I've highlighted 2 other components of the Caring Dads program, which is the mother contact and the coordinated case management. And the mother contact piece is really important for safety. So I've added the word safety beside both of those. A violence against women worker or a women's advocate reaches out to the men's partners during the group, and they can do things like safety planning or refer to services, letting the moms also know about the content of the group and the material that the dads are covering each week, so moms know what's going on. And then the coordinated case management is very important as well. And that's when the referral source would be included. So they would attend the 3 meetings. And that's also a safety factor as well. So if there's any concerns or risk factors for the dads, we're sharing that with the referral source and the person that sees the dad and is currently working with the dad. And you guys would know this well as well. So why Caring Dads? This is one of Katrina Scott's drawings or pictures or whatever. It's the historic model of how we would intervene in a domestic violence case. So my experience is in a child protection role. And typically, and I remember doing this with CAS cases when there would be a domestic violence referral, we would go out and put the protective circle around mom. So put all the pressure on mom to do all the safety planning, monitor her contact of the dad, sometimes force her to go to a shelter, getting protection orders and being quite forceful and sort of making her do things. Meanwhile, dad's off in the background and we just kind of hope he goes away. We want to isolate him, punish him, just hope he's not home. And we don't really do any work with him. So all the pressure is on mom's shoulders, especially having to deal with the CAS workers, police, and the pressure to keep herself and her children safe. Meanwhile, no one's doing any work with dad. So then moving forward to safer practice, we put the protection around the father and holding him accountable for keeping his family safe. Having probation monitoring and assessing his risk, as well as child protection, ongoing safety planning for him. How is he going to keep his family safe? And collaboration and information sharing between systems. So that's the collaboration piece of Caring Dads. That's very important. And as you see over with mom, it's we provide her with support. So intervention for the trauma and violence, supporting her with keeping her kids safe, and using a trauma-informed approach so that we can hear from her what she needs and how best to support her, and giving her helping her make informed decisions. So that was part of the partner contact piece that we were talking about in the earlier slide, how if the moms know how dad's doing, maybe dad might be doing things that are making us more worried about him and we're worried about his risk. We can let mom know those things so then she can make informed decisions. So that's using more of an empowering and trauma-informed approach with the moms. So that's why we have Caring Dads. And so why are we talking about this issue? It's estimated that 500,000 children are exposed to domestic violence every year in Canada. Majority of child welfare referrals are now for domestic violence, and the majority of these are for children under the age of 3. Men who abuse their partners are frequently abuse their children directly, and children exposed to women abuse have similar adjustment problems to children who are physically abused, and rate significantly below their peers in areas such as school performance and involvement in social activities, which puts them at risk for further adversity. And so this is right in the manual, the accountability principles of Caring Dads. And I highlighted this and created a slide around them because as a facilitator of Caring Dads, I think you need to be really mindful of what the accountability principles are. So these dads can be particularly challenging sometimes in a group. So if you know what your principles are, you can always refer back to that in your mind and know when you're responding that you're responding through these principles in some way. So principle 1, that father's involvement in intervention should have the potential to benefit children regardless of his progress or lack of progress in making change. So this is what I just spoke about this a little bit before. If we're more worried about dad or his risk is increasing, that we're making sure we're doing something about it and talking to the referral source or whoever's involved in his life, also letting the moms know if there's risk to them. So that's important to sort of not go into the group expecting everyone to maybe make a change, but also understanding that we might actually find out that they're higher risk than we thought. Principle number 2, abusive fathers are seldom initially ready to make change. So their motivation for change is likely quite low, and we need to have a program that understands that. I've heard of other programs where dads need to admit to the abuse prior to starting the program. So Caring Dads understands that dads might not be ready for that in the beginning. And so I think also knowing that, so maybe going into your first few sessions of the group, understanding that when dads come in, they might be saying, I don't belong here, or there should be group for women, that caring moms group, or having comments like that. So if you're kind of expect for dads to sort of have that resistance. And principle number 3, you can't be a good father and a disrespectful, abusive partner. So often when I, on the domestic violence team at work, if I meet with some of the women, they'll often say, but he's a good father after he's been abusive to them. And I sometimes hear professionals say that too, that although he's abusive to his partner, he's a really good dad, and the two just don't go together. So I think remembering that principle that you can't be a good father and a disrespectful, abusive partner is important. And then principle 4, intervention programs must identify and address appropriate targets for change, in particular, men's lack of child-centeredness. So focusing on the father's attitudes and relationship with a child, and it's not a child management intervention. So understanding that Caring Dads isn't teaching fathers how to manage their child's behavior. Rather, we're looking at changing their attitudes and improving their relationship with their children so their children feel safe around them. So I think if you can always have that in the back of your head when you're facilitating, that'll help you a lot. And so moving forward, preparation and using the manual. So I can't stress enough preparation for success. So what I've done, if you're working a busy job throughout the week and you have your Caring Dads group once a week in the evenings, is allowing yourself some time. So schedule it in to prepare for your session each week. What I've done in the past when I was a bit newer to the group was I created some cue cards to make sure I didn't forget some key points I wanted to make. So it was just nice having them. So if I kind of got stuck, I could look at my cue cards quickly. And reading through the session entirely prior to doing your session. So, and thinking about the current group of dads you have and how you're going to apply it. So if you're sort of like reading the exercises you're going to do, and think about the men in your group and how you want to approach them with it. And I think that helps a lot too. Planning with your co-facilitator necessary strategies. So sometimes in the group there's role plays, and during those role plays, you might want to ask one of the fathers to participate. So maybe sort of strategically planning ahead of time which one of you is going to do that, or which dad might do that. Sorry, I'm just checking. Okay. And test out any video clips in advance. So this is something that we've sometimes struggled with at Children's Aid, is our video clips. They were hard to use. We have to turn out the lights, so we'd have to ask for our security guy to turn all the lights out. So having things like that prepared ahead of time can really save you a lot of stress during the group. And setting up the room in advance. So I think it's important for the room to look comfortable and welcoming and inviting for the dads when they come in. So I like to go in and make sure the chairs are all set up, and that we order pizza and we have coffee and bottles of water. So getting that looking welcoming for the dads, making sure they have everything they need. Sometimes one of the rooms we use for the group is a access room. So I like to make sure I walk around and clean up any of the toys or anything I think might trigger the dads ahead of time. So making it feel welcoming and comfortable for them. And be ready before the dads get there. So when you're in the room, when the first dad walks in, that's when the group starts. So making sure you're on and ready, and all of that pre-engagement, the sort of chit chat you can have before the group, I think is really beneficial for building a rapport with the dads. And the use of your manual. So that manual has everything you need in it. So you can literally run the group with the manual. You have all of your, has practice tips in there, process tips, the therapeutic strategies for each goal are listed in there, caution notes. So sometimes there's certain exercises might trigger a certain response in men. So there's some caution notes on how to proceed during those times of confrontation and when to confront more and less. So those are really good to pay attention to. There's decision points as well. So you can choose which exercise best fits your group. And there's one exercise in particular for fathers whose primary concern is abuse of the child's mother. So for DV related dads, there's exercises that you can modify to sort of suit that if you find you have a group full of mostly domestic violence related issues. And there's also extra exercises if you have time. And so the facilitator team, it's important that you and your co-facilitators, at least one of you has knowledge of child development, understanding the dynamics of women abuse, so a feminist lens and approach, experience working with men and preferably male perpetrators of family violence, and training in cognitive behavioral therapy, or a good understanding of what CBT is. So moving on to determining eligibility. So it's important to know who's eligible and who isn't. So it's fathers who have exposed their child or children to domestic violence, father who have used physical discipline, and there's a list in the manual, so the eligibility is laid out clearly in the manual for you. The father has to have access to at least one child, so it could be supervised. The child could be in the care of the Children's Aid Society and is having supervised access. That counts as well, but they need to be having access with at least one of the children. And we've made the mistake in the past, I have anyway, where I've allowed a dad to come in when he hasn't been having access because it looked like he might be having it soon, and then he never did. And it was really difficult for a dad not seeing his children to be in the group. I think it actually did him more harm than good. So just being careful of that, and being sure that the father is being referred by someone who can follow up on his progress. So we're fortunate at Toronto Children's Aid because our referrals come from our family service workers. So they're in-house referrals. So the workers are involved with the dads already. So if it's an outside agency referring in, you would want to get a commitment from the referral source that they will participate in those 3 meetings, the intake, midpoint, and final one, as well as be available for consultations if needed. You'd also want to see that the dad is able to comply with the intake process. So showing some interest, ability to discuss what's going on, And it's important to note if he's not doing this, because this would also indicate a level of risk. And finally, no sexual abuse cases. This program isn't designed to deal with that. There'd be a better treatment program for sexual abuse cases. And being careful of men with significant alcohol or drug misuse. So the expectation would be that they would be able to attend groups sober. And low risk fathers who need a supportive intervention. So the Caring Dads program wouldn't be a great fit for them either, because it's not a parenting program. And so if someone's looking for a program for a dad who needs some parenting skills help or something, this isn't an ideal program for them either. So getting the referral. So when you first start off with a referral source, you would want to have a conversation with the referral source about eligibility. So ensuring that the dad is eligible. And I've had people refer from outside agencies. A couple of times we've taken some dads from a probation officer at CAS or outside children's aid agencies. And it's important that they understand what the Caring Dads program is. So I think when you're having that conversation with the referral source, explaining that it's a feminist model, there's the partner contact with the moms, the case collaboration, talking about the accountability principles a little bit, so that the referral source understands what Caring Dads is. And I think people sometimes just think it's a parenting group for dads. So I think it's really important that they understand that it's to keep women and children safe, and they can see that. Also, if you would want the father to sign consent for the referral source to communicate with the Caring Dads Facilitator, so yourself, because that open communication is the case collaborative contact piece. Collaborative case management. And that's also the referral source you would want them to agree to attend for the 3 meetings, as I mentioned before. So the intake, the midpoint, and the end of the program. And there's a final report at the end of the program that you would write, and you can share that with the referral source as well. And the intake process. So this would be your intake meeting. So yourself as the Caring Dads Facilitator, the dad would be there, and then the referral source. And on the Caring Dads website, there is a form. There's the intake form online, so you can access those there. And intake meeting is like the first session of the group. So that's your chance to meet the dad for the first time. You want to make sure he's, feels welcomed and comfortable as well, because that is like your first session. So you're sort of setting the tone. Using motivational interviewing skills and engaging with the father, you're trying to make a connection and maybe attempt a small challenge. So maybe saying, I often would say to dads, I understand you've been through a lot of stress. This must be a really difficult time for you. Understanding maybe that dads have been involved with the police or children's aid, and that must be a really stressful time. So my small challenge might be something along the lines of, is there anything that you could do differently? Or what do you think your role might have been in all of this? So I think you'll know a little bit about the father before this intake meeting, because you'll gather that from the referral conversation. And it's also a good chance to prep the father on what to expect for the group, which would help reduce his anxiety for the first night. So what I like to do in the intake meeting is just talk to the dads a little bit about what to expect. And let them know, like the first half of the group, we talk a lot about fathering and their experience as a father, and let them know that towards the second half of the group is when we might talk about more difficult subjects. So I think that sort of might alleviate some pressures, that they don't have to walk in the first night in a room full of strangers and talk about the most private things. So I like to say that to them. Also, if you do the intake meeting where the group is held, you could give them a tour of the room or show them where the room is, and let them know when they come for their first night where they can go and sit. So I think all of that really helps set the tone for the group. And you could also, in your intake meeting, it's a chance to establish some small goals. So asking maybe what their hopes are, what they would like to achieve. Hearing from the referral source is important, why they referred the father. And again, just highlighted that the coordinated case management is also, it ensures the child's safety. So that's why we do that. And intake process continued. So I think I mentioned most of this. It's time to gather information, make a connection with the dad, attempt a small challenge, develop hope in the dad for some change. I sometimes see these intake meetings can go quite well. I can see a bit of a relief on the dad's face, because they think, oh, this might actually help me. Reviewing the service agreement and developing goals. And finally, assessing, it's your chance to assess the dad's risk as well. So there is a list on page 31 in the curriculum, in the manual, that determines who high-risk dads typically are. So characteristics, so stepfather, common law relationship, children under the age of 4, if they have a history of child maltreatment, if they've injured a child, or if the fathers kept the child away from the mothers for long periods of time. So the list is in the book. I just wanted to highlight that, though. It's good to pay attention to if a dad is a stepfather, and when you do your genograms, which comes later on in the group, asking dads which one of his children maybe he has a difficult relationship with, and that can maybe be some of his goals can be created around that child. So it's good to know who these guys are. So moving forward, as you would know, the 4 main goals of the Caring Dads program. So tonight's session is clinical consultation is for goal 1, to develop trust and engage the dads and have them start thinking about their fathering. So the next session you would do is increasing men's awareness of child-centered fathering. And then moving on would be men's awareness and responsibility for the abusive actions and the impact it has on children. And goal 4 is rebuilding trust with children and planning for the future. And a good tip that I've written down at the bottom is stay within your goals during the session. So if you are, and sort of like when I was speaking about the accountability principles, you're aware of those when you're doing the group, as well as you're aware of the goals. So sessions 1, 2, and 3 are all under goal 1. So when you're running the exercises for sessions 1, 2, and 3, really thinking that what is your overall goal is you're trying to build trust with these dads, you're trying to motivate them, you're trying to engage them, and you want them to start thinking about their fathering and examining that. So if you kind of run the exercises, remembering that that's the goal you're in, I think that's helpful, because I think the group can be overwhelming, and having something to sort of fall back on. These are some tips that have been helpful for me. So goal 1, as we've said, develop trust, engagement, and thinking about fathering. That's tonight's session. Key therapeutic goals, for goal 1. So modeling respect. And this is really important to think about when you're facilitating the Caring Dads group, is being calm and modeling respect, particularly when maybe things are getting a bit tense or stressful, or through difficult conversations with dads, or dads that are showing a lot of resistance or challenging you, is to remain respectful and calm. And you're modeling that for the dads. It can show them when they're in difficult situations how they can act as well. It's a challenging group with the dads can say some things that might trigger you personally. So it's good to really keep that in mind, that you're modeling respect at all times. So that's something to stay calm and remember that. Non-defensive responding to men's challenges. And so it's expecting as well. So you can anticipate that dads will say things like, I don't belong here, or there should be groups like this for women, caring moms, you'll hear. So just expecting that and knowing dads will likely say things like that, or you'll get some dads that say that, and just being able to roll with that resistance in the beginning. So remember, we're in goal 1. So if this is later on in goal 3 or 4 and dads are saying things like, there should be groups like this for my partner, then you would want to challenge that. In the beginning, we're not doing that yet. Moving from generalities to specifics. So I think that's really important. The dads often say things like, for goals, they'll say that I want to be a better dad, or I want to be a good dad. So it's moving from that general goal to a specific. So what things do you need to do to be a better dad or a better partner, or to go home? So keeping that in mind when you're creating goals with the dads, to be as specific as you can, as well as when you're running the exercises, is when they're giving you really general points to try and bring it and make it more specific. Avoiding confrontation. So here in goal 1, we'll avoid confrontation throughout the group. And like I said, rolling with the resistance and just expecting them to not be ready yet. They're just coming in for the first 3 weeks. So this is where we're trying to build the engagement. This is designed to work through that process. And developing discrepancies. So men's desired outcomes for their actions. So an example of this might be if a father comes home from work every day and screams and yells, and his child hides in his room because he doesn't want to see his dad, but he's saying, I want my child to come and run and give me a hug when I get home every night. So sort of highlighting for them maybe what's going on there and talking to them a little bit more about that. And encouraging men to give feedback to each other. So that's part of the group cohesion, having dads sharing things between each other, encouraging feedback, encouraging them with their goals, checking in with them. So that's something to really encourage and start off right from the beginning. So we're here in session 1, which is the first night of the group, and it's orientation. So what we start off with, and this is very clearly laid out in the manual as well, so you'll be able to read through all of this. So your program overview, you want to let the dads know about what the program is and sort of just review some of what the program entails, what to expect. I like to create an agenda, letting the dads know sort of the topic of the evening, what time break is, that we'll be doing homework at the end, checkouts, that sort of thing. In past groups, we've had a dads be sort of like the timekeeper, and he can let us know when break is. So if you're sort of in the midst of something, they can sort of say, okay, it's 7:30 break time. And when you're creating the rules with the group is doing it together with the dads. So you do have certain rules that you want to make sure you include, but also, oh, I see we have someone new here. Is this Cheryl? Are you here? So if you can hear me, Cheryl, we have Madeline and Amanda here. So welcome. I'm almost through my PowerPoint presentation, so but it's being recorded and you'll have an email sent to you with the link for this, so you can hear all about it if you watch it afterwards. So I'm just at session 1, so we're just talking about the orientation for the first night, letting dads know what the group is about, and creating rules with dads. Letting them know about the importance of doing their homework each week, the importance of participation, letting them know. Oh, okay. Hi, Cheryl. That's great. Okay, good. Sorry. I thought you just checked in, but I saw that late. Thank you. So yeah, creating rules together with the dads on a flip chart. So asking them what they feel should be included, talking about confidentiality. And it's important to remember at this time too, it's a time for men to voice concerns with the group. So if they want to air sort of their grievances of why they've been referred, allowing time for that to happen. And again, you're doing that in you're listening, you're validating, allowing them to be heard. And often I find with working with dads in these settings, like Caring Dads program or being on the domestic violence team, is that sometimes dads haven't felt like anyone's listened to them. So really what they want is just to feel heard. And so giving them that time to vent and feel like they're important and what they have to say is important, and validating that can go a long way. So in session 1, our first exercise is what is a dad? And you would have seen this in your facilitator training. So we were doing a brainstorm of what it means to be a good dad, a good enough dad. And then you contrast those two lists with creating a list of deal breakers. So what breaks that rule, the contract of trust and safety between a father and a child. And these activities that you do, it's like the foundation of the group, and you hang up every week. So when you're creating these brainstorms, the good dad, good enough, and deal breakers, each week you'll rehang up that list that you've brainstormed with the group, and you can refer back to it as you need to as the groups build. So that's an important thing to take your time with this exercise, let dads get a chance to get to know each other, and remembering that you'll be using this kind of moving forward. And at the end of session 1, you can go around and do a checkout, invite men to talk about their thoughts and feelings about the first group. And it's also important to note that you want to end the group on a positive tone. So if you tend to have a particularly angry group of men and they're quite unsettled, you might decide to not check out and maybe just sort of wrap up and shake everyone's hand and invite them back for next week. Or if you have a couple of dads that are struggling or seem quite angry, ask the pro group dads to check out first. So maybe they'll set the tone for a more positive checkout. So you can be strategic with that as well. And so session 1 tips. Allow time for men to voice their concerns about being referred to caring dads. Respond to men in a non-defensive manner and model respect and a calm demeanor. Reflective listening and use of validation of men's feelings when they're feeling frustrated that they've been treated unfairly. Be careful to still maintain control of groups. So just you are allowing time for men to sort of vent and be heard, but as well as making sure that you're still maintaining control of the group and not letting it turn into like a bashing fest about women. So you're still managing the group and maintaining control of the group, but you're allowing men to feel heard in a safe way. And constantly encouraging men to participate and to sort of to think about the work they're doing, to do their homework, to talk about fathering with each other. Also, just being mindful, maybe if some dads are a little bit nervous the first night, and I wouldn't pay to center someone out the very first night, but maybe if you notice someone was quiet, you could speak with them after group and ask them, how is it best for you to get them to participate, or what do they need from you? Complaints about child's mothers. So you can refocus the group back to knowing that later on in the group, we will explore these problems. And the group is designed to help men dealing with conflict in their lives. So I say that to men in the intake process as well, that often men are dealing with a lot of conflict with their children's mothers or their family members. And this group helps men to reduce that conflict. So if they're complaining about child's mothers, to let them know that we hope that we can help them resolve some of that. And being mindful of too much disclosure. So on the first night, being careful not to probe too much, especially when you're doing the deal breaker exercise. We don't want them to disclose too much because that may deter them from coming back if it's been too much the very first session. And we talked about if men are still angry, that you can be strategic about your checkout. So moving on to session 2, considering fathering. This is where we do the genograms. And so what you would need is big sheets of Bristol board and some markers and tape. And for each dad, this would be like their check-in. Each dad gets a turn to talk about who's in their family. So you're asking dads who their child's mother is, their 2 children's or however many children's names and ages, asking where the mom and children live, asking the dad if he's not in the home, when he sees the children, what his access is like with the children. And if there's any support people in his life. So sometimes we add in, he could have his parents or a neighbor or someone that's involved in the child's life that's important to add. So we do this for every dad. And then the second half, we move on to family experiences and patterns. So this one is on page 46 of the manual, and it's how I was fathered, how I should have been fathered, and how does my child experience me? And it's important when you're doing the brainstorm for these 3 topics is to also include the children's mother. So you want to ask how my father treated my child's mother, how my father should have treated my mother, how my father should have treated my mother, and how do I treat my child's mother? And you'll see that exercise on page 46. And develop men's motivation and hope for change through this. So now they're starting to think about their own experience with their dads, things that they liked about that, and maybe things that they'd like to do differently, so they can have that conversation. And I do remember this exercise being difficult for some men if they specifically have had a really terrible childhood or traumatic childhood. This can be hard for them to talk about. So being gentle and allowing time for that. I've had men be quite emotional when they're recalling some of the things that their father did, and especially when they're thinking about how I should have been fathered, that can really provoke an emotional response. So keeping mind of that. And if someone does have quite an emotional response, is allow time for that. So you don't have to stay right so rigid on the exercises, roll with the group and make sure you're meeting the needs of the dad. So if a dad needs a little bit more time to sort of talk about an issue, you can spend time doing that. If you need to take a break, to allow the dad a few minutes to step aside or whatever. So you can make time for that as well. And session 2 continued. There is a homework assignment. So week 2 is the first homework assignment. And in the manual, at the back of the manual is the homework book that the dads get. So page 157 in the manual has session 2 homework. And what that homework is, 2 goals for your relationship with your child. So men are asked to think about 2 goals they have. And then for session 2, you check out with your thoughts and feelings of the sessions and encourage that hope for change. And again, maybe shaking hands with dads or asking them, will I see you again next week, and getting that sort of agreement that they'll be back. And moving on to session 3 is developing discrepancy. So again, we start off the group with some check-ins, and if you need to, you can complete genograms that if there was any dads absent the week before. And then you're going to take up the goals. So the homework assignment for session 2, you're going to take that up, and this is your exercise 1. So this can take you about 40 minutes. And so you're going to go around the room and ask each of the men to share at least one of their goals. And you can also use the group here as well, ask dads to comment on the goals or share feedback with the goals and help hold each other accountable. So, if someone has a goal and we ask them, we're going to check back in next week, you can ask the rest of the dads in the group, can we check back in with Bob and see how he's doing next week? So it helps create that group cohesion. You can write the goals on the genogram so the goals can stay up there and the dads can look at them and see them each week. And you can add to them and change them as things progress over groups. So that visual of the genograms on the wall is really important. You often see dads during the group looking up at them and thinking about, you can sort of see them looking at their genograms and probably thinking about their situation and how it applies to the activities. And make sure that the goals are things that the men have control over. So for example, a goal a dad might say is for my child's mother to respect me more. And so asking the dad in a gentle way, because this is only session 3 still, so we're still in goal 1 being developing trust, is maybe asking him what could he do to help his wife and him have a better relationship. So bringing it back to something that he has control over, that he can manage. And the second half of session 3 is continuing to develop discrepancy. There's 3 options there. 3 activities. So you can pick the one that you think suits your group best. The facing the wall activity, you can read about the 3 activities in the curriculum. It's a good one for men that are dealing with a lot of systems and potentially a domestic violence case where there's criminal charges, there's no contact orders, they're out of the home, they're dealing with children's aid, maybe their access is being supervised and they're sort of dealing with all of the systems and barriers. The facing the wall activity is a good one to help them see how they can move forward. So that's where this is the one where there's a decision point. You can pick the best one to suit your group. And if you see, I've highlighted at the bottom there, worksheets are, there's worksheets for feelings. They're on page 156 to 159. And you can use that if you choose option 1. They can help that exercise. And then again, at the end of session 3, there's a homework assignment. Oh, and then I added in this last slide to just show the impact. So before I go there, I'll just sort of wrap up this. So that's everything I was going to talk about tonight. I went through the 3 sessions. There are, I don't know if you guys got a chance though, there were self-reflection sheets that were emailed to you as well as videos. So the videos are of Katrina Scott and Tim Kelly, and they talk about the sessions and similar to what I've just done. And also they do an example of the activity. So you can watch Tim Kelly actually running the exercises in a mock session with some dads in the group. So you'll be able to watch those sessions being done live. So I didn't go too deep into them because you'll be able to see him facilitate them. And Katrina gives you a good overview as well. So I think once you hear it over and over again, it should all sort of sink in as well. So I'm just going to move on to my last couple of slides. So just I liked this slide that JP gave us. So the average Caring Dads Facilitator conducts, let's say, 3 groups a year. So if each group is attended by an average of 12 fathers, each father in turn could be connected to an average of 1.5 moms and 3 children. So a single facilitator can foster the behavior change in 36 fathers that ensures the safety of 54 mothers and 108 children every year. So the great thing about this is I think you can feel good about the work you're doing if it's helping keep women and children safe, and especially when you look at those kind of numbers. So I think you can, when you're maybe having a really difficult group, you can feel good about that. And finally, okay, so we've got time now. We can chat and hear from everyone their thoughts. We can have some time for discussion, questions, experience with the group, or if you haven't started yet. And that's it. So when you'd like to speak, can you just put your hand up and then you can turn your mic on when it's your turns. Does anyone have any questions, discussions, thoughts that they want to share? And I see that we also, so there's the self-reflection guides are there for you. I think those are important to do when you're running the group because it gives you a chance to really think about how you manage yourself throughout the group. As I said, it's a really challenging group and these dads can be difficult and can provoke things in you. They can say pretty sexist things and oppressive things, and this can be pretty triggering. So the self-reflection is really there to support you through it and make sure that you're staying on task and staying in line with the accountability principles and the goals. So we still have an hour and I think 15 minutes left. So we have lots of time for any questions, thoughts, discussions. Did anyone get a chance to do the self-reflections or watch the videos? Are you guys still there?
Hey, I'm still here. Can you hear me?
Oh, yeah, gotcha.
Okay. I didn't have the chance to do the reflection yet just because I haven't been home, and I also haven't run a group yet. I probably won't be doing so till the fall, so I don't have any like burning questions yet.
Oh, that's okay. Yeah, for sure. So you think you'll be doing one in the fall?
That's what it sounds like. Yeah, I think I certainly won't be doing one before the fall.
Yeah, okay. Great. So yeah, I guess you wouldn't do the self-reflection until you're actually doing the group then.
Exactly, yeah.
Perfect. And I think, a lot of this, you covered a lot of this in the 2-day training that we've done, that you did, the facilitator training. And then your manual has everything in it. The videos are a lot of what I'm saying as well. So you'll be well prepared, I think, for when you do the group.
Totally, yeah. Better to have more than less.
Well, and I think like when we first started out doing this group at CAS, we were sort of fumbling through it. So I just like to think of all the little tips and things that would have made things easier way back when we first got started. So
Totally.
awesome. Thank you. And Amanda, did you get the link okay? I see we got it on here.
I tried the most recent link, but I'm still getting, it says like 404 error and it can't find the page.
Oh, okay. We'll make sure you get them. We'll send you, I'll make, either way, if it comes up here, it'll be emailed to you. So you'll get it for sure.
Okay.
I'll make sure all three of you have what you need. We're just starting off with these webinars. So this is new to us as well. So we're just getting this all sorted. So
it looks like on my end, there's a little tab that says handouts, like chat pulls handouts, and
Yep.
I was able to download them there.
Oh, excellent. Perfect.
Was that, can others see that?
Yeah. So you can access the handouts okay there then.
Yeah, so I don't know if the people who weren't able to get it through the link, maybe they would be able to get it through that tab.
Yeah. Sorry, Cheryl, did yours worked then? Oh, yes, we can definitely email them to you if you'd like, Cheryl. Has anyone started? Oh, great. Has anyone started doing the group? Cheryl, have you done a group yet? Oh, no, I can't hear you. Is your mic on? We'll problem solve. We've got someone in here that can help. Oh. Is your mic working, do you think? Do you have it turned on?
Cheryl, you can turn on your microphone in the top right-hand corner. There's some icons there. Both your microphone and your webcam should be off. You can turn your microphone on just by clicking on it.
Any luck, Cheryl? Well, while Cheryl's trying that, and Amanda, you said you haven't started doing the group, so Amanda and Madeline haven't done it yet. Do you guys have any worries about starting the group or anything that you wanted to sort of talk about, like before you start doing a group, if let's say both of you end up doing it in the fall?
To be honest, I think actually for me, from my understanding, I'm going to be able to go in as a research assistant first. And like, so I probably won't actually facilitate a group for quite some time. So, okay. which I'm happy about, because like I'll be able to go in and see what they're like and take more of a back seat. You know, and be able to see what it's like to facilitate a group before actually jumping in myself. So I feel really like good about that.
Yeah, that's good and prepared. Then you'll be in a great position by the time you do it then.
Totally. Yeah. So,
well,
I'm sure, you know, once I get there, I will have some worries, but, you know, I think right now I feel good that I can take it slow like that.
Yeah. Excellent. That'll be at Toronto Children's Aid then.
Yes.
Yeah.
Yes. Right? It should be, right?
Yeah, I think that's where you would do it, because there isn't any yet in Toronto. I don't think there's any other ones other than, unless something's happening that I don't know about, but which there could be. But
okay. Yes. Then that sounds right. There is it the building that's like close-ish to U of T?
Yes, it's on 30 Isabella, so it's just south of Bloor.
Yes. Then that's where I would be doing it.
Yeah. Oh, and then I see Cheryl. I'm just going to read what you have here. So, you haven't done a group yet, so you just wanted to get a sense of the support. Okay. That is offered via Caring Dads. So do you mean in terms of these like clinical consultations? So you would get these 4 clinical consultations available to you. Then you do the 2-day Caring Dads training, and there's the website as well, which has tons of links and resources. So there's articles on there. There's videos for you to view. So there's videos of all of the sessions, so you can watch them being facilitated in a mock setting. There's plenty of resources on there, like in terms of the referral and intake sheets. So everything you need is on that website. And then if you had any other needs that weren't there, there's email on there as well. So you could access the email if you had questions or needed more support. So we'd be there for you as well. No, you don't pay for the online resources. I don't believe you do. So once you're a facilitator and you have a login, you would have a Caring Dads login. You can go in and access everything on there. So the website really does have everything that you need on there. Oh, there is an annual license fee though. So I think that was on the last one of my slides too. Oh, yes, there is an annual licensing fee. Oh, okay. So it was asking for fees now. Hang on, I'll find out. So it's $100 a year to access for everything. I don't know what your particular situation is, but I could, if you like, maybe, because we're so ahead of time, and I think everyone hasn't done a group, so it doesn't sound like there's lots of questions, Cheryl. If you'd like, I can talk to you on the phone afterwards. It might be easier so you can actually speak. So if you'd like to do that, do you want, I can give you my cell phone number or something, or would that be helpful if we can have a quick conversation when we wrap up? Yeah, okay, cool. So I'm just gonna give you, here, I'll put my number on here. There, you can call me on this number, but we'll just wrap up first. So is there anything else? Anyone, any questions, comments, or any other thoughts about the material we covered tonight, or anything else you need from me while I'm here?
I guess just as a general question, having, like Madeline said as well, having not done the program yet, I was just curious, based on your experience, you've done this program a lot. In the first 3 sessions, if a dad was saying something like you mentioned, that there should be a Caring Moms program and things like that.
Yeah.
what type of responses do you give as a facilitator to roll with the resistance? And again, you're not challenging it so early on in the program, but just to get a sense of some of the things that you would say to a nun like that.
Yeah, I think it's just allowing them to vent and talk about that a little bit, and maybe ask them what's kind of going on for them, if they're dealing with some things that are making them say that, and always focusing it back to what they have control over. So, you're allowing that space to talk about it and hear for them that they're frustrated, or they think maybe their partner should be doing groups like that they're not, that it's not all them, but allowing them to then think that they're here, this group is about them. So refocusing it back onto themselves. So letting them, this group is going to help them think about things that they can do differently, ways they can improve their relationships with their children or their children's mothers. So sort of having them think about focusing it back to themselves a bit. And another good tool when you're getting questions like that or comments like that, you can also, you can use the group and ask the group, what do they think about that? And typically you'll have a few sort of like allies in the group too that will speak up and say, we're here to get some help, or we're here to learn how to be better dads, or that sort of thing. So I find that's helpful as well. I guess the manual as well has some good tips and process notes as well, has some good comments.
Along the same lines, how do you typically tend to respond to, you said sometimes there are sexist comments or maybe triggering comments about being a female facilitator. What have you found is the best way to kind of manage that?
Yeah. Again, it depends on which goal you're in. So in the beginning, you're going to expect that. And I think you have to be able to have a bit of a thick skin and be able to roll with that a bit. Mm-hmm. It's okay to sort of agree to disagree sometimes. So I might maybe speak in general and just say, so if someone's making a pretty sexist comment, I might not direct it right back to the person making the comment, but I might say something along the lines of, domestic violence is a really serious issue. And there are some situations where, women get really hurt, and, I worry about those women, and I work hard to help keep them safe. And I sort of make it more general for them. So I'm not sort of pointing or centering a guy out. Talking more about why it's important. Right. But again, if you're in session 3 and someone's saying that and giving you a hard time, I'd be a lot more direct. I might even just say and be real and in the moment and just say, as a woman standing here in a group full of men, that makes me feel uncomfortable or something. So maybe, that might be different towards the end of the group. So I guess it's just where you're at and managing that. And like I said too, you want to maintain control. So you don't want chaos. You don't want all the men spewing out sexist comments. There's, when we also, in the beginning of the group, we create group rules. So it's, we talk about that using your child's mother's first name, that will be respectful of everyone here, that confidentiality. So I think when you sort of set the tone with those rules in the beginning as well. So it's all that pre-work and prep as well that goes on. How do you feel about, and also there's the male and female dynamic too. So typically the group is run by one male and one female. Mm. So you can use each other to respond to those things as needed. So sometimes the male facilitator can be supportive of the female facilitator, and he could maybe tackle that one.
Okay, cool.
Use the dynamics of that.
I actually didn't know that there's always a male and a female.
Typically, that's what we strive for.
Cool.
Sometimes staff issues, it's not always the case, but that is the goal, and that is how the program's designed. Yeah. Madeline, do you feel like maybe if you were in that situation, how do you feel like you would manage that?
I mean, it's definitely one of my top kind of things that I worry about with working with this population in general, and what that is like, and just I've worked with clients individually in the past who I felt like were trying to push my boundaries, and I tend to be kind of sort of deferential and not really know what to do in those situations. And, I'm sure it's different when you're in a group setting, but it's something that I definitely that has crossed my mind. I just want to make sure that I feel equipped to deal with that, because I know that like, what I might do, like just like laughing and smiling isn't necessarily how you want to deal with that moment, right? Because
Exactly.
you want it to be maybe a teaching moment, potentially, if that's appropriate. And like you said, you want to maintain control. Yeah. So I know that's long-winded, but it is something that worries, or not worries me, but that I think about,
Yeah, absolutely. I think that's where the self-reflection sheets can come in as well. And, and another key when you're in goal 1, 2, and well, throughout the whole program, you're modeling respect.
Mm-hmm.
So if you don't agree, you can show that you don't agree in a respectful, calm manner. So it's okay to let someone know if they say something sexist that's impacting you, that's not an okay comment, but you can do it in a very reasonable, calm, and respectful manner. And it is modeling that for dads as well. That is life too. There's conflict and people are going to have differences. So you're showing men how you can still have differences and get along as well.
Yeah.
And I hear what you're saying, because when I first started working with domestic violence team at Children's Aid, that was my first thing that I said when I went to speak to my supervisor was, I don't know how I can handle these guys. But I think once you start doing it, you do. Like,
I can totally see that. Yeah, like once you're actually there, it's probably, and I'm sure I would imagine there's probably less sexist comments and less, those kinds of things than you might expect. Like,
yeah,
yeah.
I get comfortable with it and manage that well. It's good that you have that reflection. I think that's the key thing for yourself, is being able to reflect and think about that. Know that might be a trigger for you and how to manage that, or using your co-facilitator. So if you're with a male facilitator, that they could maybe handle that piece for you as well.
Yeah, that's a really kind of, I'm glad to hear that. Not, that I had no idea that it was typically tend to be like.
That's the ideal, but I think it's not mandatory. So it's that practice to have male, female facilitators. As I said, like staffing issues and stuff like that, sometimes it doesn't happen. So
for sure, yeah.
But you could see, like, if you had 2 female facilitators, it might feel like that you're ganging up on the men. And then if it's just 2 male facilitators, there's not the woman's voice. So that's a reason why.
Yeah, totally. I definitely thought about that in terms of like, oh, how would that change the dynamic if you have this room full of men and then you have 2 female facilitators? What would that be like?
Yeah, exactly. And so, yeah, and the good thing is if they're expressing themselves, it means they view you as someone who will listen to them. So maybe they feel comfortable. They're able to say those things. So that's also a good sign. If they're able to air what they're thinking, it's good because we're getting to know them and hearing from them.
Right.
So that's what we're doing. So when you're in goal 1, you're motivating them, you're building that trust, you're engaging, you're getting them to think about their fathering. So I think the more that they can participate and talk, that is good as well, because you're staying in those goals and accountability principles.
Right.
And expecting this a bit. These are the guys that are coming to the group. They likely have distorted thinking. They likely have sexist thoughts. They've been abusive people. So, you expect them to be like that in the beginning as well. So having that kind of understanding and kind of knowing who these guys are before you start.
Right. Okay, that makes sense. Yeah, that was a really good question.
Yeah, thank you,
Amanda. Yeah, thank you.
Thank you. And anything else? Does anyone else have? I'm sorry, Cheryl, that you can't get to speak, but we'll chat afterwards. And Amanda and Madeline, any other thoughts or things you wanted to talk about?
I think that's it for me.
Okay, great. That's okay. Yeah, it's okay if you don't have anything else. I just want to make sure you get use of the time if there's.
I just had a quick question that I just thought of. How would you handle in terms of, you might not necessarily know during the referral process, but if you have a group that, and I apologize, I have my windows open and there's a train going by, so if it's really loud, I apologize. How would you handle it if the group gets started and two of the guys are neighbors, or they work together, or they're friends, and they didn't know that they would be doing the group together?
Yeah, that's actually a really good question, because in Toronto, we don't tend to have people that know each other as much, but I hear that in the smaller communities, everyone knows everyone. So in one of the videos, Tim actually addresses that really well. And they talk about that in the beginning, confidentiality. So how do the dads want to proceed with confidentiality? How do they, whatever they talk about in the room stays in the room, and you develop that within the rules, the group rules at the beginning. And in Tim's video, he does that really well when he's, because two of the guys are talking about, I don't want anyone else here knowing about my business, in their mock session that they do. And they talk about how, if you see each other on the street, maybe you wouldn't go up to each other and talk about group. So does that answer your question?
Sorry. Yes, that answers my question. Thank you. And those videos, are those on the portal?
Yeah, I think they might have been emailed to you, but yes, they'll be available on there. Tim and Katrina have done videos of all of the sessions.
Okay.
They're really great because I like that you can see them. Like you can actually see a session being done. And it's that question you just asked was exactly one in one of the videos. So.
Okay, great. Thank you.
I think it's okay if they know each other, because it is supposed to be a safe place, and they're maintaining confidentiality. And in small towns, like a likelihood of them knowing someone, or they could know the child, their partners. So there is a good chance that everyone could be connected in some way or know each other or family members. So really just making sure that everyone understands confidentiality. And I'll make sure you'll have everything. So like what I'm talking about, if you don't have it on the site, I'll make sure that you do have the videos and everything you need. So are we okay to wrap up now, or? And before you go, so I'll start to wrap things up now, unless anyone has any other questions. I am going to send you, so when I log out, I'm going to send you a little quiz to complete. So I'll send that to you. And thank you very much for participating today. It was great. It's a small group. So typically when you do the future ones, there'll be more people. So the great thing about that is the more questions, you can hear a lot more, and people that have been running the group hear what they're doing and some of the issues and struggles they're having with the group, or questions they have about the group. So I think you'll learn a lot from the future sessions as well as they come up and become available. And thank you again for your patience, because this is the first one I've done these webinars. So I was worried a little bit about the technical stuff. So thank you for being patient. Okay, so I'll send you the quiz right now. And if you need anything else, you can email the Caring Dads site and we'll get back to you right away. So thank you. Bye, everyone. Okay, bye.